we're going to have 10 to 15 minute presentations, depending on which presentations. And then we're going to work really hard to stay on schedule so that we'll have lots of time for question and answer at the end. Okay? And I do want to say a big thank you to our planning committee for this event, Stu Cohn, Elizabeth Edsel-Trom, Danelle Buckman, Shawnee Paraska, and Rosie Melendez. Thank you all for your help. And of course, a huge thank you to all the Healthy Howard staff who came and helped with this event and helped out this afternoon as well, especially our fantastic LHIC program manager, Alvaro Ortiz. And now I just want to introduce our health officer and LHIC co-chair, Dr. Maura Rossman.
Hello, good evening. I want to thank Jean Ann Scabera, who is our great LHIC director, for making this possible and coming together. And all the people behind her that made it happen, that she's already acknowledged. I just want to say before I start, the county executive was invited and was planning on coming, and at the last minute, he is still working on budget details that need to be finalized. So he is, quote unquote, burning the midnight oil in preparation of going to Ireland tomorrow. So I feel sad for him tonight, but I guess Shlante, or however that goes, tomorrow morning. So he sends his regrets, but he also says that he plans on coming to the next time, so I guess we'll have to do a redo. Maybe not as big. My job, so for those that don't know me, I'm Maura Rossman. I'm the health officer, and I've been health officer since 2012. And the LHIC actually started in November 2011, so it's now 4 years old. And many people in this room, because I found the initial roster of members, and looking around, actually, there are folks in this room who were at the first meeting. So I don't know, you don't have to, but if you would want to raise your hand to even acknowledge that you've been with us for 4 years. All right, so thank you, everyone. As I said, it started in 2011, and this local health improvement coalition was part of the state health improvement process through the Department of Mental Health and Hygiene. And I want to acknowledge Dr. Cheryl DePinto from the Department of Health and Mental Hygiene, who's here with us today. And the concept was that if Maryland and the individual counties were going to start moving the needle on health issues, that they really needed to start looking at population level data, and it had to be a grassroots process in terms of the residents deciding using data, what their health issues were, and then how were we going to tackle that. And as you can imagine, in the 24 different jurisdictions in Maryland, there's different health needs that exist within each county, different population, and different ways of thinking of how we might tackle it. I think in Howard County that we have really the good fortune of being very lucky that we have pretty good health outcomes. Robert Wood Johnson puts out a survey or analysis every year of the different states and the counties, and we're number 2 again in terms of being the healthiest jurisdiction. Montgomery County is actually considered the healthiest, and there's all different variables as to why that exists. And part of that is in Howard County, we are a very diverse population. We're relatively speaking, a very well-educated population and high income. So my expectation is we really should be the healthiest place on the planet. And my job is to try to figure out how to make that happen within the different systems. And my way of thinking is that I'm not smart enough, creative enough to do this alone, that it really takes the village, and I'm very fortunate to have quite a huge village around me, and you're all part of that village by coming tonight. And we work very closely with the hospital, and you'll be hearing from Mr. Steve Snellgrove after me. We work really closely with county government, some of which we have some former county employees who started with the LHIC. We work with our Board of Health, and I want to acknowledge our Board of Health member, Daryl Burnett, who's here. Thank you for coming, Daryl. And with our medical organizations, some of which are here tonight that have worked on a number of pilot projects to improve health, because the health department, we do deliver some services, direct care services, but by and far, most of us, and I'm a Howard County resident, receive our health care from primary care providers in our community. Bill Solway's out there, who's one of our primary care providers who makes it happen at Columbia Medical Plan. So my job is trying to figure out what are our needs and how do we make that happen. And this local health improvement coalition is really integral to the process. And the only way the process, I think, can really happen well is by getting feedback from the community. We meet pretty regularly, the local health improvement process committee or coalition, since 2011. We meet, we have a website, and we can share that with you, or there's a card that you can go to it. We meet during the day. For those of us that, again, have the privilege of our jobs paying for us to go to these meetings, we can do that. And Stu Cohn, who's been a member for a long time, said, we really need to do something for other people to reach out, let them know all the good stuff we're doing, and we have to hold it at a time that people can come. Hence why we're meeting 6 o'clock during a weekday. So when you get the survey, please look at the survey and give us your feedback so we can make changes if needed, or we can pat ourselves on the back, or do whatever other next steps that are needed. You will hear from our various priority groups. We started out with 3 priority groups. Access to care, obviously very important. In Howard County, we have an aging population, and we have a significant number of our population with chronic health conditions. And if we're going to begin to tackle chronic health conditions and prevention and treatment, then access to care sort of is figuring out different ways of doing that. And these are in no particular order. We have another committee that is working on behavioral health issues, and most recently, a lot of us have heard in the media about the heroin epidemic, and I'm sorry to say it's real, and it's real in Howard County. But we're also trying to work on access to behavioral health treatment for a variety of mental health and substance use disorders within the county. The third priority area was healthy weight. Obesity in both adults and children is an issue in Howard County. When you look at our metrics, it's very stable, meaning we're not really getting any better or any worse, but it's still affecting a disproportionate number of our population that leads to chronic health conditions, and we continue to work on that. And last but not least, we added a 4th one that you'll be hearing about, and that's healthy aging. Because if we're all going to continue thriving in Howard County, I think, at least I'll speak for myself as I get older, I want to be self-sufficient. I want to enjoy the quality of life that makes me want to get up in the morning, regardless of if it's to work, to the park, or to wherever it is, or enjoying the garden, or if I ever have grandchildren. But that's another story. So that's healthy aging. And you'll be hearing from all of those committees who right now in the past 6 months have been really working on projects to try to roll out different things within the community. So pay attention, give us feedback, and come to the next meeting. I'm going to stop there. I get the pleasure of introducing my co-chair. Again, I don't feel like I do anything ever alone. And I have the pleasure of co-chairing this with Mr. Steve Snellgrove, who used to be new to Howard County, but I don't think he gets to say that anymore. He is CEO and president of the hospital And I have been really fortunate to have someone like Steve to partner, collaborate, or just sound off to about different projects. We have, as you know, one hospital in Howard County, so as a resident, we have to make sure that, you know, the hospital is meeting our needs and vice versa, and Steve has been a real collaborator in that process. So I'll turn this over to Steve.
Thank you, Maura. I guess chronologically, I still feel like a newcomer, just 2 years into this community, but there's a lot going on in healthcare these days, so it also feels somewhat experienced. You know, when I first came to Howard County, I was really delighted to learn there was a local health improvement coalition. When I first sat down with Maura and Nikki from the Horizon Foundation and kind of talked about a vision that is uniquely enabled here in Maryland because of the Maryland waiver, and I said, you know, we really need to get all the providers together in a room and connect ourselves with electronic medical record and know where the patient is and how to keep people healthy and well. We really need to create this organization. And they kind of looked at each other. We already have that organization. So it was truly a thrill to find and meet many of the people here in the room today who are so passionately driving towards the same goals. And I don't think you find that across the country. So I want you to know how blessed I feel to be in Howard County, how blessed I feel to bring the wisdom and the talent of Johns Hopkins Medicine to us as one of their member organizations, and then really trying to figure out how we can leverage that to keep us all healthy, well, and disease-free. As president of the hospital, I'm truly thrilled to serve as co-chair with Maura. It's important that the hospital and the health department play key roles in this because we can't do community health without a hospital, and you can't do community health without the community, so you all serve well in that capacity. And for those of you who are here really for the first time tonight learning about this collaboration, we really need to know what your questions are. We really need to hear from you and begin to incorporate the public into our mission. Dr. Rossman and the health department are really positive partners in the collaboration. Amongst their many contributions, the department is funding the Community Health Resource Platform, which helps improve the allocation of resources based on the patterns by tracking referrals in our community. This has already been done in primary care, and we look forward to helping expand to specialty care and other resources. The level of cooperation among health-focused organizations is really not common in most communities. Our community should be very proud of the potential of this relationship. We have the capability to work as partners and do so in a timely and efficient manner. With partners cooperating, sharing data, we don't anticipate barriers. The point is to come together as a team to determine where the demand for services are and work with our partners to position the supply of partners where that demand is, where feasible. Community health needs assessment has helped us do that by informing our planning for the last few years. For many years, public-private partnerships have existed in the county, and the goal of preventing disease and improving access to care in an effort to decrease health disparities. So it's wonderful that, again, that's existed. So the LHIC is natural and an outcome of all those efforts. The coordination and collaboration amongst the county's public health, healthcare, and social service organizations, married with this entrepreneurial spirit to test concepts, mean that we know how to work together and to achieve our ambitious healthcare goals. The hospital's role as part of the coalition is key for a couple of reasons. First and foremost, it's the right thing to do. It is our mission not just to serve the acute care needs of our community, but also to involve the health of our community, to improve the health of our community. We want to help as our friends, our neighbors, and community members all engage in healthy lifestyles and behaviors so that they will stay well. Secondly, the hospital reimbursement is now structured to align clearly hospitals with this mission. Howard County General Hospital has worked with several members of the coalition to develop a model for population health. Population health means that we will prospectively work to identify the health needs and risks in our population, in our community, and create services to keep us well. It includes issues like lifestyle, socioeconomic situation, and the prevalence of certain health conditions. By studying our community, we are able to position services to meet those needs and the patient or persons where they are. We have only one hospital in the county, and we hope that you will all consider it to be your community hospital. A majority of our residents choose the hospital for their acute care needs. We don't provide all the tertiary and quaternary care that you typically find at the academic centers that are near us, like the University of Maryland or Johns Hopkins, but we hope to be able to create a red carpet experience and access to those facilities to make sure that we take care of the needs of our community. At the end of the day, we are trying to position our services where the demand is. Not everyone needs or should come to the hospital for all of their needs. Instead, many of those services need to be available in our communities, in our neighborhoods, nearer to where people live, and at a lower cost than an emergency room setting or acute care hospital. Social service agencies already are in the community in many instances. For example, in our community, the North Laurel Multi-Service Center has 6 different social service agencies located together to help the public. Really a one-stop shopping center. It may be helpful to have primary care services there as well, in addition to services like rehabilitation, lab, maybe x-ray, so that you can literally walk to your primary care visit. We think we can provide some of those things in Howard County on an economical basis. The recently developed population health model, which is called the Howard County Regional Partnership, builds on and seeks to leverage the work and progress already made by LHIC members in the 4 community health priority areas, which Mara already described as access to care, behavioral health, obesity for both adults and children, and healthy aging. While the regional partnership is initially focused on the high-use, high-need Medicare population, what we have built is strong enough and intertwined with the LHIC so that it will be able to move to address other populations in the months and years to come. By the way, we are awaiting word now in the funding about the partnership for the Maryland Health Services Cost Review Commission. We've made it through the planning phase. We got a grant to do that. We submitted an implementation grant. We made for the first and second phases of that, and hopefully I say this, the last step is a 2-hour public interview where we're going to bring some of you folks there with us to petition to the state and help them recognize that we have a plan that will work and be very successful in our community and make it through that final round. In the coming remarks, we will hear from the work groups that are focusing on each of the 4 areas that we've identified in our health needs assessment. Howard County is ahead of the curve in its efforts to provide care to all residents of our community and is uniquely capable of designing a population health model. Howard County General Hospital and I personally am proud to partner with the health department and the other organizations in this effort. We are your community hospital dedicated to the health of your care. Now, a little bit of housekeeping before we get into the next presentations. Later tonight's forum, our agenda includes a question and answer session. In order to prepare, we ask that you think of possible questions for the various work groups and topics. Please use the note cards that you have in your seats, hopefully. And write your question down on a note card. Following the presentation, the cards will be collected. We might be easiest if we just move them all towards the middle of the room. And then one of the staff members will actually ask the question on your behalf. And we hope that you really enjoy this evening's presentation, gain some knowledge about what's going on, and again, provide us thoughts and guidance about how we can be the best we are and make Howard County the healthiest county in the world. Thank you very much.
Okay, so the first, we're going to have each work group give a snippet of what they've been working on and what they plan to work on. Liz Clark, who is Director of Community Health Promotion and Chronic Disease at Healthy Howard, as well as Kelly McMillan, who's an Assistant Professor of Health Education at Howard Community College, will be presenting. So come on down.
So the Healthy Weight Work Group was formed based on national, state, and local data confirming that obesity is a major epidemic in the United States. In the U.S., 70% of Americans are either overweight or obese. This trend has continued and is continuing. Even our children are affected. 20% of adolescents and 17% of children are obese. In Maryland, 65% of residents are obese, and racial disparities exist among the population. Our trends are in line with national data. They continue to increase. As trends continue to increase, so do the health-associated risks, including diabetes, hypertension, cancer, even breast cancer, esophageal cancer, colon cancer is associated with obesity, and those are increasing. In Howard County, despite our affluence and education, we still have high rates of obesity, lower than the state and lower than national averages, but still high. And we also have racial disparities that exist among our population. Those racial disparities with regard to obesity also include the health disparities that are associated with obesity, including, as you see here, diabetes. So there's certain sections of the population in Howard County that are affected more by obesity-related conditions, which is why, when polled, 35% of Howard County residents said that they were that they were advised to lose weight, and 37% of men, and more women, not surprising, 51% of women were trying to lose weight at any time in Howard County. This is why we are working on this problem. We want to make it easier for those folks who are advised to lose weight and are trying to lose weight. We want to make it easier for them to do so in Howard County. We use data from the Howard County Health Assessment to develop our goals. And Liz is going to talk about some of the things that we've done over the past year.
Hi. So, it's kind of tricky to manage two hands at once.
Lose weight.
So, a few things that we learned from the Howard County Health Assessment were that almost a third of Howard County residents eat 0 fruits or 0 vegetables. That is tremendous information for us. We want it, so another thing we learned is that we're still drinking a lot of sugar-sweetened beverages. That means we're having a lot of calories in our days and we're not getting a lot of vitamins from fruits and vegetables. So what did we do about this? The Healthy Weight Work Group created a strategy to increase access to and consumption of healthy food and drinks. And we do this through a few different actions. The first is, we're going to talk about our success because we love successes. We were able in the last year to bring a farmer's market to the health department where we serve a lot of WIC clients. And so we were able to have people come pick up their checks and then walk to a booth and get fruits and vegetables. Perfect for access to fruits and vegetables. This summer, we're excited that the roving radish will actually also be coming to the health department and be able to extend that work. We focused a lot on creating partnerships and understanding what was going on in the county in terms of bringing food, healthy food, to people in an affordable and convenient way. So we managed, we talked about, and with a Movable Feast, Meals on Wheels, the Roving Radish, Hungry Harvest, and really have been working to make sure that people who need access to affordable, healthy food can get it through those partnerships. We had some advocacy success. We've worked to support local, state, and national healthy food policies, including creating a letter that we sent from the full LHIC to the FDA to support the added sugar amendment to the food labels. And this is, so for those of you who don't know it, it's what it's going to look like if this works. It takes a while for the FDA to really push things through, but the one on the right here is what we're looking for so that added sugars really stand out. This new label also talks a lot about, it makes it much more obvious to understand how many calories you're consuming and how many servings are in a container. So we're working on education along those lines too. We also were really proud to support the work of Transition Howard County in November when they did a Healthy Eating Fest. And so when our different partners have events in the county, we work really hard as a coalition to promote that work. In addition to the healthy eating focus, we learned that a lot of people still need to be exercising in Howard County. So we have a physical activity, increase access and participation in physical activity in the county. To that end, we were really excited last year to promote the work of Get Active Howard County and really get as much involvement as we could. And we had a record year of over 1 million minutes logged. We hope that's going to go up this year. And the table for Get Active Howard County is over here. Please go get some information and sign up. We also we're happy to, as a coalition, and particularly from the work of the hospital, We Promote Health, and Healthy Howard to present We Walk for Wellness at North Laurel, which went through the course of the spring and summer and really created a wonderful community of walkers that were getting together weekly, families, to get things done. And we have advocacy for our physical activity goals as well. We were promoting open streets and the bike plan. When the bike plan was open for the public, we worked really hard to make sure that people got on the website and talked to and let the county know what their needs were and what their hopes were for the county. We also learned that a lot of people still need education about what's happening with their health. And so we support education activities related to healthy living. In the last year, that particularly focused on these beautiful, you think they're beautiful, health guide resources around issues that are completely related to healthy eating, physical activity, sleep, access to low cost or free healthy foods, pre-diabetes and diabetes, and quitting smoking and hypertension. We also did a lot of work last March, a year ago, to promote sleep, because we know now through a lot of research that's been coming out that sleep is critical for healthy weight. There's a lot of direct relationship there. So that was last year, and this is the year to come. We're really excited about what's going to be happening in 2016. We're going to be creating more guides, and we are going to actually be working to promote more farmers market and access to healthy food venues. We're going to continue to grow our partnerships. We're adding dentists and dental hygienists to the Healthy Weight Work Group for a more comprehensive representation of the community stakeholders. We're also continuing to promote low-cost and healthy food partnerships. With advocacy work, we're working this year. We've added a strategy to really help support the work of the implementation of Wellness Policy 9090. And the school system is involved with our group, and we're very excited about that this year. We're supporting the bike plan and the complete streets plan that the county is actually looking at right now. There was a hearing this Monday about that. And we're promoting Bike to Work Day, March 20th. Put it on your calendar. We've got a plan for it at Healthy Howard. We're all meeting up at somebody's house. We're going to ride together. So, yeah, I got some. Oh, it's April?
You said March 20th.
Oh, I meant May. I'm sorry. I'm nervous. May 20th.
We're listening to you.
Yeah, thank you. That's impressive. Good. And then we're going to continue to really be aware of what's happening in terms of responding to relevant legislation. We want to get everyone getting active in Howard County. Please sign up. There's teams from lots of different organizations as well as community teams. We want you to get a good night's sleep, and we are going to be creating a dental hygiene guide as well. So we'd like to leave you with a call to action to do 3 things from this night. If you take home, we'll be so excited. One is identify a person that you know needs access to healthy, affordable food and help them make that connection. If you don't know how to make that connection, please pick up one of these resources because it can really help you do that. The second is sign up, please, for Get Active Healthy Howard County, and let's make this just an incredibly banner year for this spring for getting active and being really active. And then, last but not least, every night this week, 7 hours of sleep. The luxury is incredible. The benefits are amazing. Let's go to sleep. No, we still have more to go. Please stay awake. I'm sure that Liddy will really appreciate that. Thank you very much.
Thank you, Liz and Kelly, for describing all that work that you've been doing. I'm going to put a plug in for the Howard County Health Assessment Survey. The data was shown on your screen. The first survey was actually done in 2012, and this was the first time that Howard County was able to obtain local data to give us the information that we needed to understand what gaps existed or what the health status was of our residents. The survey was duplicated again in 2014, and in 2016, this summer, there will be another Answer the Call survey, which is a telephone survey both by cell phone and landline in both Spanish and English. We survey approximately 2,000 Howard County residents across the entire geographic area. So if you receive a call, please answer the call. One of the things that we're learning now with our cell phones is that we're easy to screen the call and not take the call. But if we don't get the information from you, it may skew our data. So enough about the plug for that. So next is Liddy Garcia, who is the Executive Director of Healthy Howard, who is a great partner, and you can see a lot of the work that on prevention and innovative pilots for health programs is done through Healthy Howard. Liddy is the chair of the Access to Care work group, and she will be describing both past, present, and future projects.
So my other co-chair, so I'm not just the chair, I'm a co-chair. So Dwayne Oberlander, can you wave your hand? He's right here. He's the other co-chair of my Access to Care work
So
group.
I'm getting a free ride. She's doing it.
That's right. And if you're on my Access to Care work group, can you just raise your hand? Lots of representation here. Okay, so I'm going to go ahead and get started. So this is our work group. There's my name and Dwayne's name. So I'm going to talk first about common stories about access to care. Oh, let me go back. So this is Joe. Joe is a college student, and he bought health care for the first time, health insurance. The only thing he could afford was a catastrophic plan because he's under 30. The problem is, it's affordable month to month, but now he's avoiding health care because of the fact that everything is huge. It's a lot of money to get any kind of services. This is Marissa, and Marissa recently had her parents join her here in Howard County as immigrants. They're not eligible for Medicare, and her father has a health condition. So she ended up buying a platinum plan for her parents. The problem is that the cost of the platinum plan is very expensive month to month. So she's having a hard time figuring out how to budget the costs. This is Sherry, and Sherry just aged out of her parents' insurance. And she is utterly confused on what to do. She is self-employed, so she doesn't get benefits through her employer, and she doesn't know where to go for help. But she needs health insurance. And this is Ben. Ben bought health insurance. However, he didn't buy dental insurance. So after 2 years of not going to the dentist, he now has a toothache and doesn't know what to do. Finally, there's Gina. And Gina is a limited English proficient resident of Howard County, and she can't find a provider who speaks her language. So it's having a hard time with accessing services. So those are a few stories just to sort of get an idea to all of you of what we're seeing here in Howard County. So access to care. We believe that Howard County residents should have access to affordable, comprehensive, local, and timely health care. Our action plan includes navigation, enrollment, and comprehensive services. Consumers need to know where to go to enroll in health insurance and obtain needed health services. That's navigation. Enrollment. Consumers need to enroll into health insurance coverage either through Medicaid, Medicare, or a qualified health plan. They also need to get the care they need when they need it to keep themselves healthy. So I'm going to, sometimes they say you have to hear it 3 times in order to really get it. So I'm also talking about the Howard County Health Assessment Survey. So it's a phone survey. This is an old phone. Most of you don't even recognize it, but this is a phone. It is to 2,000 Howard County residents. It's conducted every 2 years. As you see, we've done it in 2012, in 2014, and we'll be doing it again in 2016. It assesses health-related behaviors and risk factors, for example, chronic diseases and healthy living. So what does it say about access? 9% of residents do not see a doctor regularly. 1 in 8 residents with incomes less than $50,000 have ended up in the emergency room because they could not get a timely appointment with a doctor. The percent uninsured is decreasing. Financial barriers are also decreasing. Uninsured rates higher among residents with less education. Residents whose incomes are less than $50,000 are more likely to go to the emergency room and do not have a usual place to go for medical care. Access to dental care is a big issue with those who live in Columbia and with residents who do not have a high school diploma. Cost was the primary reason why residents did not access dental care. We've had success, though. In 2013, Howard County had a 6% uninsured rate, and in 2015, we're at 4%. It's one of the lowest in the state. We do have disparities where we know that the Black and Hispanic communities have a disproportionately higher rate of uninsured, and we know also the ages of 18 and 34 also have larger uninsured rates. It's important to note, though, that the highest number of uninsured in Howard County are the whites. So our focus in the work group is on 3 things. 1 is financial. 2 is cultural and linguistic barriers. And the 3rd is just utter confusion. You liked that, didn't you? So in order to address financial barriers, as I stated before in Joe's case, he bought a high deductible plan because that's the only thing he could afford. So if you look at this diagram, you see the bronze level is affordable month to month. But unfortunately, as you go and get services, they're expensive. So a lot of times people are delaying care for the financial barrier. So what does our work group want to do? We want to focus on preventative free services. Part of the Affordable Care Act does state that all of the essential health benefits provide free preventative services. So those include, for example, annual visits, prenatal care, immunizations, cancer screenings, mammograms, and colonoscopies, and more.
Uh-oh. Well, it's on the other side.
Oh, there we go. It started again. It also, one of the things, too, that a lot of folks don't understand, when they're insured, they do get the benefit of a negotiated rate with a provider. So if you're uninsured, you don't benefit from a negotiated rate. When you're insured, you pay less because the insurance company has negotiated those rates on your behalf. Additionally, you are protected with a maximum out-of-pocket. So if you have a year where there's high expenses for whatever reason, you are protected because you do have a maximum that you will pay in any given year. So to address the cultural and linguistic barriers, we want to ensure that all information is in multiple languages. So this is an example of a toolkit for connecting to coverage. This is in 6 different languages. We also want to advocate for bilingual and bicultural staff, both at the time when someone's looking for health insurance and also when they're accessing services. And also to ensure competent translation and interpretation. So, now that we have 96% of Howard County residents with insurance, how do we, the whole goal now for our work group is ensure they know how to use it. So our focus is on health insurance and health literacy. We'll be doing this through workshops, one-on-one literacy sessions, and an electronic and paper toolkit. All right, so this is the fun part. I'm going to, in front of you, you have a quiz. So I'm going to ask some of the questions, and I'm going to see hands for questions or for the answers 1, 2, 3, 4. This is from Kaiser Family Foundation, and this is going to be able to assess your knowledge on health insurance. So the first one is, which of the following is the best definition of the term health insurance premium? Is it number 1, the best type of health insurance you can buy? Raise your hand if you think that. Is it 2, the amount health insurance companies charge each month for coverage? 3, a bonus you get at the end of the year if you stayed covered? Or don't know? Okay, it looks like everybody said it's number 2, which is correct. So the premium is the monthly fee all enrollees pay in order to have health insurance coverage. Don't worry, they're going to get harder, okay? But 76% of Americans answered this question correctly. I'd say Howard County is pretty educated. Okay, number 2. Is a health insurance premium something you must pay every month, regardless of whether you use healthcare services, or do you only have to pay your health insurance premium during the months when you use healthcare services? 1, raise your hand, must pay every month regardless of whether you use services? Or number 2, only have to pay the months when you use healthcare services. Okay, you're all right. Again, you must pay insurance premiums every month, whether you use them or not. Okay, now they're getting harder. All right, this is another step up. Suppose that under your health insurance policy, hospital expenses are subject to a $1,000 deductible and a $250 per day copay. You get sick, you go to Howard County General Hospital, and are hospitalized for 4 days. And the bill, after the insurance discounts are applied, comes to $6,000. How much of that hospital bill will you have to pay yourself? Is it 0? Raise your hand. Is it 1,000? Raise your hand. Okay, there are a few people with 1,000. 2,000, raise your hand. 4,000? Or don't know? Okay, so we have a mix here. So the answer is 1,000. And the reason why is you have to pay 1,000 to reach your deductible, and then it's $250 copay each day times 4, which is another 1,000. So it's $2,000. Did I say 4,000? Oh my goodness, I'm so sorry. I meant 2,000. It's 2,000. It's a $1,000 deductible and it's a $1,000 copay. Okay, sorry. I'm just messing with all you. Okay.
It's too much math.
It's too much math. Okay, so again, they're going to get increasingly difficult. This is very good. Next question. Which of the following best describes the annual out-of-pocket limit under a health insurance policy? Is it 1, the most you will have to pay in deductibles, copays, and coinsurance for covered care received in network for the year? Raise your hand if you believe that. 2, the most your insurance policy will pay for covered services in a year? Or 3, the most you'll have to pay for premiums in a year? Or don't know? Well, it looks like the overwhelming majority thought it was 1, except for a few who thought it was 2. 1, health plans sold through the marketplace, and most employer health plans must cap the amount you are required to pay each year in deductibles, copays, coinsurance for covered services received in network. So that's what I was talking about in terms of the maximum amount of pocket that anyone will pay in any given year. Okay. Which of the following best describes the health insurance formulary? Is it 1, the form you send to your insurance company when you need to have a medical bill paid? Raise your hand. Is it the name for permission you must get from your insurance company before surgery will be covered? Raise your hand. Or 3, the list of prescription drugs your health plan will cover. Oh, you guys are so smart. It is. The list of what drugs your health plan will cover and what cost sharing you owe for different drugs is called the drug formulary. Not all health insurance plans have the same formulary. So whatever health insurance plan you have, check the formulary. True or false? If you receive inpatient care, let's say at Howard County General Hospital, that participates in your health plan's provider network, all the doctors who care for you while you're in the hospital will also be in network. Is that true? Raise your hand. Or false? Raise your hand. False. Often doctors who work in a hospital when they work in the hospital, they don't always work for the hospital. So check again with your health insurance provider. It's not always the case that providers who care for you during an inpatient stay are in your network. Suppose this is, I think, the last one. This is the last one, okay? So stay with me. You ready? This is the toughest one. If you guys can answer this, then I swear Howard County residents are the smartest. Okay. Suppose your health plan covers lab tests in full if you go to an in-network lab, but only pays 60% of allowed charges if you go out of network. You forget to check and go get your blood test at a lab that turns out to be out of network. The lab bills you $100 for the blood test. Your health insurance allows only a $20 charge for that test. How much would you have to pay out of pocket for that lab test? Is it 0? Is it 40? Okay, there's a few people that say 40. Is it 80? There's a lot of people that are saying 80. Is it 88? Or is it, I don't know. So raise your hand again if it's 88. Okay, so Brian Jollis, explain to us why it's 88.
Okay, so you got, come on, Bob, help me.
He's a broker.
60 is 12 from 100. Okay, so it's 88. Well, 60% of 100 is 80.
Okay, so 60% of the $20 allowed amount is $12, right? So $100 minus the 12 is 88, okay? All right, so as you can see, and what's interesting about this one is only 16% of Americans knew this answer. And actually, I would say out here was probably like 60. So we're actually really quite smart here in Howard County. So what can you do? Get insured and/or encourage friends, colleagues, families to get insured. As you see, we're already down to 4% uninsured, but we still can get down to 2%, I would say. 2, familiarize yourself with your health plan. How much do services cost? What is free? Know if your provider is in or out of network. Don't delay care. Establish a relationship with a primary care provider and make sure you get your preventative services. Keep yourself healthy. And these are resources to help you stay healthy. I think Liz already talked about them and took full credit for them over there on the table. But they are here for you to be able to understand what resources are here to make sure you stay healthy. Answer the call. This is what you can do. So again, this is probably the 3rd, maybe 5th time you've heard this. Howard County Health Assessment Survey is coming in April. If you get this phone number on your phone, answer it. These are the group of partners that are doing the Howard County Health Assessment Survey. Lastly, these are the organizations represented on our work group. And thank you.
Now we all feel like we're really smart Howard County residents. I said we were highly educated, and we've just proved the point. I just want to let you know that obviously we can see how complicated health insurance is, and at least in my opinion, our entire healthcare system is pretty complicated. If you have questions about health insurance, every day that the health department and Healthy Howard are open, someone can either call or walk in, and we can help you with determining what health insurance you may be eligible for, from the spectrum from medical assistance to a qualified health plan, and even make referrals over for Medicare as well. And, you know, on a personal note, I have a child who is, trying to think how old she is. She turned 26. And when the Affordable Care Act came out several years ago, it was at the time when those of us that had kids in college, they could stay on our health insurance plan, but once they aged out, they came off, which was pretty scary, at least for a parent who wanted their child insured. And my family benefited from allowing our college-age children to stay on my employer benefits through age 26. So Sarah was covered, yay, she gets a job, she's still covered. She decides she wants to change her career, she goes back to school, still covered, and then came off her insurance when she aged out at 26. And the good news is she was able to go to the health department, get assistance, and is insured, which helps me sleep better at night, and actually it makes her sleep better at night knowing, and she's very good at accessing the system, made sure she had a primary care provider all linked up, and actually when she switched from one insurance to the other, all her providers are exactly the same. So we shouldn't make assumptions as you're switching that if in part you do your due diligence and your homework, as Liddy has described, that you can actually maintain excellent benefits. All right, moving on to our next group, which is our behavioral health work group. Another person that I have really the good fortune and privilege of working with over the years is Donna Wells, who is our executive director of the Mental Health Authority in Howard County. And Donna, for many years, has done really a great job at advocating for both the mental health as well as the substance use needs in our county. So I'm going to turn this over to Donna.
And I would not be doing my job as the mental health director if I didn't say there is usually not very good coverage for behavioral health, although there's 96% of people who have private health insurance. We hear that every day in my offices, and so please be aware that when you do look at insurance coverage, I mean, behavioral health coverage is mandated under the Affordable Care Act, but I guarantee it isn't as comprehensive as you would like it to be when you need it. So please keep that in mind. Okay, my colleague, Ro Rogers-Bonacorsi, who's the Director of Behavioral Health at the Health Department, she is not here this week, so I'm here doing for both of us, but she's been my partner in the Behavioral Health Work Group. And I'd like to have the folks who are in the Behavioral Health Work Group in the audience raise their hand. There's quite a few of us here. Thank you for all of you and all your help and work with this group. Oh gosh. Light touch. Overview. Okay, what we're going to talk about, for those who don't know, after the incident at the mall in January 14, the previous county executive Allman funded something called the Behavioral Health Task Force, which we got funded for in 2015, FY 2015, and I co-chaired that with Nikki Bernick at the Horizon Foundation. And that was a broad-based community group that looked at behavioral health issues across the county, across the spectrum. And a lot of the things that we're working on now really kind of were identified as 9 big priorities in that work group report. So we're going to talk a little bit about that. And then we're going to talk about our work group and our action plan and our next steps. So I'll kind of run through this. And I talk really fast. I grew up in a big family, so if I talk too fast, raise your hand. Hold your microphone up. Okay, we're just going to do it. The task force, these are some of the recommendations that we've been working on with the task force. I mentioned about the county exec, and County Executive Kettleman has thankfully continued to support that effort in the county, and we're very appreciative of that. And that's the purpose of, was to build that robust behavioral health system across the community. And I mentioned who was chairing it, so I can move on from there. Some of the recommendations that were funded from the Behavioral Health Task Force to date were the community care team that the Health Department, Healthy Howard, operates, and we'll hear a little bit more about that. The biggest priority and the number one priority was the lack of urgent psychiatric care, where someone could be seen between 24 and 48 hours by a prescriber, by someone who could assess them for medication. We have walk-in crisis counseling at Grassroots. We have a hotline at Grassroots. We have the mobile crisis team at Grassroots, one of our major partners. But there are times when people are in crises and they need to be seen by a psychiatrist. So, and again, it was a public-private partnership between the Hospital Horizon Foundation as part of the task force that we did begin operation of what's called a rapid access program through one of our major clinics in the county. And we'll talk a little bit more about that later. But basically, we really For the first part of the 3 months, it was operated by just referrals from the hospital, and then in January, we expanded to community referrals. So we're really happy to have that available in the community, and I just used it yesterday for a family, so it's really a very needed service. And then the other issue that came up was having resources readily available. We have a directory that's been in print copy online for many years, and so we are working with technology service to make it more user-friendly on mobile devices. And you can see I can hardly use a clicker, so I need a lot of help with that kind of stuff. And we hope to have that up and running pretty soon, but it's a lot more complicated when you get into that than it sounds like up front. So we're still working on that. These were the 3 goals of the Behavioral Health Work Group: expand access to care, behavioral health care resources, as I mentioned, and to reduce emergencies. There's, as Steve would be glad to tell us, there's a real hit on the hospital in terms of behavioral health emergencies in the emergency department. We do have a behavioral health emergency room for adults, but it's always swamped. There's never enough beds. We're always struggling with that. So we're trying to figure out how can we reduce emergencies. The second thing is increased suicide prevention activities. I bet many of you don't know that we average 20 suicides a year here in Howard County, and that's been a consistent number in all the years that I've been here. I often get asked, how does that compare to the state? I don't particularly care how it compares to the state. 20 is 20 too many. We want 0 suicides in the county. So that's another target area for us, is trying to decrease the suicides. And then the third thing is reduce the number of drug and alcohol intoxication deaths. I think all of us know that's been a big push at the state level, at the county level, and we really have, Ro could probably cite it off the top of her head, the percentage of increase we've had in opioid deaths just over the last year. It's really tremendous. And the unfortunate thing for me is that, this is statewide, and every community is affected. And I think for years we kind of closed our eyes to it when it was only a Baltimore City problem, but now it's a problem everywhere. We really have to pay attention to it. So our first goal was expanding access. As I mentioned, we started the pilot program, the Rapid Access Program, and since September 1st, and this is data just through December, I don't have most recent data, more than 100 individuals were served. 51% of those have medical assistance, which is public system eligible folks, and then 49% have private health insurance. So for me, at the Mental Health Authority, it's who are those 51% who have Medicaid? Are those folks who have been in the public system and dropped out? Are those folks who have never been in the public system but have medical assistance? So we need to look at that data and see how we can outreach to them. But the insurance thing gives us the information that we need to kind of go back to the insurance companies over time and say, these are your folks. You need to help us better serve them in a more quick way. Because what happened, and what we heard in our behavioral health task force, was you call your insurance provider, you get a list of numbers, no one's taking patients, or they can't see you for 6 to 8 weeks, or the number doesn't work. There's all kinds of reasons why people can't access care when they have behavioral health coverage. Our second goal was, as we said before, was put a behavioral health specialist on the community care team. The community care teams already existed, but they didn't have behavioral health specialists. So an individual was hired in October, and as you see, as of this date, they provided services to 67 patients, 18 of which have had serious behavioral health issues. So that's, I think, going to help with that. Mental health first aid. For those who don't know, mental health first aid's been around for a number of years. We had some funding at the county level to expand trainers and to expand the services, and we've been working on that. So right now we have 33 instructors that we train just in Howard County. There are many more trained around the state. And we've offered 28-hour trainings, and 25 people have been trained just since January of 2015. And we're really trying to target the general public with this. Clinicians know the basic information. This is really what we call, like, if you think of CPR training for medical folks who aren't medical personnel, you learn CPR, you can keep someone's heart pumping until the medics get there. Mental health first aid is similar in that you give general basic information about identifying the signs and symptoms of mental illness so that you know what you're seeing, and then you can hopefully link them to resources in the community. So we're really trying to target the general public. Crisis intervention training. We've been doing in Howard County since 2010 with our partners NAMI and Grassroots. We developed a curriculum, 40-hour-a-week training for patrol officers. And we've had a great partnership here with the Howard County Police Department around this. So they get intensive training on all kinds of issues related to mental health. And it's really had an impact in how they handle situations when they respond. They're our first responders. And we have a very strong partnership with our mobile crisis team funded through grassroots, as you know. So this has really helped with that. So far we've trained 277 officers and, in the CIT, and I think the chief's thinking is to have the whole department trained at some point. The online directory, I talked a little bit about that. We hope to have that up and running, hopefully shortly in the next month or so. It's just, again, become, it was a much bigger project than it sounded like when we first started down that road, so we're still working on that. But we hope to have it where it's searchable by mobile devices. If you put in what insurance you're looking for, or if it's a specific language or a specific specialty, like you're looking for someone who works with gender identity issues, or you're looking for someone who just works with children. So that's what we're hoping to find with the searchable features. Suicide prevention activities I mentioned. We did get funding from the county to start what's called an ED follow-up program, and that's funded through grassroots. And we really are targeting folks who are multiple users of the emergency department or for suicidal threats, but don't meet the criteria to be admitted to the inpatient bed, or ones who frequent the emergency department 3 times in the past 6 months. So since March of 2015, we've served 50 individuals in this program. And again, we're trying to really shift their focus from the hospital to grassroots, so that when you want to talk to somebody, they call grassroots rather than go to the emergency department. Reduced drug and alcohol-related intoxication deaths. As I mentioned, we have the overdose response program trainings for naloxone. That the health department's been running those pretty consistently over the last several years. They've done 19 trainings. They've trained 168 folks. And the individuals actually get their free doses of naloxone at the training, which is something new that one of our partners started working with the health department on. So they don't have to go and, don't have to worry about them filling the prescription. They actually get the prescription during the training. And there has been the establishment of 3 permanent medication collection boxes at the police department stations, Glenwood, Southern, and Northern police stations. And as you see, we've collected over 1,300 pounds. And I believe we have April 30th is another drug collection date, Joe? Yes. So I think you saw the flyer for that. Again, reducing drug and alcohol-related intoxication deaths. We've established an overdose fatality review team that meets quarterly, and they're just getting off the ground, but we're really hoping they're going to have an impact in trying to bring down the deaths we're seeing in this area. These are our next steps. We're looking to develop a way to better partner with primary care providers around behavioral health issues, review and analyze our data for suicide at-risk populations, and increase awareness and participation in drug prevention programs through the social media, newsletters, forums. So that's what we're working on now. We have groups that are working on these 3 things. If you'd like to join us, let us know. We're open to that. Thank you. That's it.
Just a reminder that we are having our final committee up in a second, but if you have questions, write them down, pass them to the center. Is that how we're collecting them? Passing them to the outside, so you don't forget your question. And I want to acknowledge Joan Scarnacci, HC Drug Free, who works very closely with Donna, with Ro Bonacorsi, in prevention activities in regard to addiction. So thank you, Joan. Okay, last but not least, we have Star Sowers, who is the director of the Department of Aging in Howard County Government, and she is the chair of our Healthy Aging Work Group, which, as I mentioned, I guess about an hour ago, is our newest committee. Star.
Thank you. Well, I'm really lucky because I have the absolute fantastic opportunity to now say officially, we are kicking off the Healthy Aging Work Group for the elderly. And we have 2 co-chairs, and I'm going to point them out right now. Courtney Barkley, please raise your hand. Stand up. She's manager of the Health and Wellness Division for the Office on Aging. And we have Peggy Hopkins, and she's the manager of ADRC for the Office on Aging. Now, the clicker is right here. No, I don't think so. Foot. And my foot. Oh, that's okay. planning. The exciting thing is we've already had some people sign up, and we're taking your names today. And thank you. But just to give you a little bit of background, okay? Most of you probably know these numbers. But just to give you the demographics for Howard County, by the year 2035, it is projected that 28,000 Howard County residents will be 75 years of age and older. Howard County's 85 and over population is going to increase by 253% by 2035, rising to just about 24,000 people. And this older demographic is essential for the threshold of the planning that we have to do in Howard County. Our vision for the Howard County Office on Aging is to create an age-friendly community where older adults can comfortably age in place and residents of all ages, I'm with Donna, not great, and residents of all ages have the resources they need to grow, thrive, and live in dignity. So, we embarked on a big, just wait on that one. We embarked on a big project, and that was, we did a master plan, and I think most of you are very familiar with that, creating an age-friendly community. It's the 20-year master plan. It was commissioned by the Department of Citizen Services. It was paid for by Howard County government. It engaged about 1,600 people in the community, and it reflected both national and local trends. And the issues that we've heard and we've identified, we're all going to be working on for the next 20 years. The focus of the Healthy Aging Work Group is to promote the overall health status of the aging population in Howard County. And we see that the Healthy Aging Work Group is going to be an integral part of moving this plan forward with all of our partners that are all around here today. We're excited. We feel that we will have the opportunity to harness the collective knowledge of its members to strategize on the success factors that contribute to healthy aging. We're going to be able to expand our outreach efforts to existing health promotion and disease prevention programs and adapt new ones and see what's going on across the country and start new things. And we're also, going to something that Lydia was saying, we want to increase the use of clinical preventive services. We want to find every possible way. If it's health fairs, if it's in-home services, we want to do it all, and we want to do it with all of you. And we want to generate a definition of healthy aging for all residents of Howard County. So this group is going to create the mission, the goals, and identify specific short-term outcome indicators that will contribute towards sustainable approaches for the 2016-2017 year. And then we're going to evaluate all of our outcomes, and we're going to make sure we have really strong data. And so the kickoff is Monday, April 4th, and literally, if you don't know where the Ellicott City 50 Plus Center, it's right across the driveway. So we want you there, okay? We renamed our senior centers to 50 Plus Centers because we want everybody to feel really welcome. Please come a little bit early if you want to. If you haven't been there, you can get a tour. Right across the street is the fitness center that we opened a few months ago. So the kickoff, April 4th, and our two people that are co-chairing it are Courtney and Peggy, and they'll take your names tonight if you'd like to be on the committee, and we are very excited that we are now doing this. So thank you very much. Thank you, Star. So that concludes the presentation portion. We're now going to do a Q&A, question and answer. So are we asking all of them to? Yes. Okay, so Deanne, if you have a question, please pass it forward or to the side.
Start with, we intended to ask you to write the person you're directing your question to at the top, but then we forgot. So we'll start with this. In relation to the presentations, how can people volunteer with any of the departments that are here? Oh, and do you guys have, you have one of them.
I can answer. The Office on Aging. The Office on Aging has a volunteer coordinator, and Darlene Vassaleras, and Ashley, Courtney, do you know her extensions?
Not on hand.
But it's online, and you can register online.
Could I have just a clarification of question? Do you, whoever wrote it, do you mean how do you volunteer for a work group or?
I think it works. Let's assume that.
All right.
So if you want to volunteer, I would suggest you contact Jean Ann or Alvaro, and you can go online for the Local Health Improvement Coalition. They have their own website. And do we have little cards that people can
Yes,
take
the
home?
little cards here have our website at the bottom. There's contact information, and you can get in touch with us that way.
Jean Ann, when is our next meeting?
The next full LHIC meeting, we meet on the fourth Thursday of every other month. So the next one will be May. So the fourth Thursday of May from 8:30 to 10:30 a.m. at the Health Department. And that information is also on our website.
And the work groups meet every month.
Yes,
In the months in between.
that's correct, yes.
The behavioral health, we meet every week.
It feels
Come
like it.
join us.
Okay, good. What will the recipient of the Howard County Health Assessment Survey receive on his device or caller ID? So it will say, I think it says HC Health or Howard County Health? Howard County Health? Howard Health. Thank you. Howard Health. That was easy. Okay, this says behavioral health, mental health, first aid for faith-based groups, question mark. So I think that would be done.
We do have, you take the general training, and then there's subcategories that you can get certified in: public safety, faith-based, etc. We actually did just do a training 2 Saturdays ago for a group of faith-based folks. So we're always looking to reach out to the faith-based community. It's been my experience that people usually turn to their primary care doctor or their faith community when they're first struggling with a behavioral health issue. So we're very interested in reaching out to that. So if anyone's interested, just contact me at the Mental Health Authority. I think our website's on the thing. Are we going to post these on the LHIC website, our presentation?
The presentations? Yes.
Yes, because our website and everything's on there, so you can certainly contact us, and we'll be glad to help you with that.
Okay, where are the HOCO help guides available or marketed? Liz, do you want that one?
They are available on the website. Are they on the LHIC website? I know they're on Healthy Howard's website. They're also on LHIC's, and they are available right here and right now that you can grab a handful. And you can also contact Jean Ann, Alvaro, or myself, and we would be happy to set up a drop-off for you. Also, in our nervousness, Kelly and I forgot to ask the Healthy Weight Work Group representatives to stand up to to get some accolades. So if you would please stand up if you are part of the Healthy Weight Work Group. Thank you.
Okay, how are you assisting seniors raising grandchildren? I'm going to say that's Office on Aging.
Okay. Thank you very much. Right now, we do have, in fact, Peggy, could you talk a little bit about the grandparent program?
I think I can talk loud.
Oh, okay, fine.
Pretty loud voice. Do I need to go up One of the programs we have within the office is called a Family Caregiver Support Program. And through that program, we support not only regular caregivers, but also grandparents who are caring for their grandchildren. So contacting that program would be very beneficial. Also, through our Office of Children's Services, they also work a lot with grandparents. So we work in tandem to help grandparents. So call the Office on Aging or call our Office of Children's Services. Either way, you'll get connected.
Want to emphasize that there will be a longevity aging forum known as Getting Older Isn't Optional, How You Deal With It Is, Saturday, April 16th at Slayton House in Columbia. Thank you, Slayton. Have you considered integrating health in all policy to help reach the overall HOCO health goals? I think that's a health department question.
Yeah, so from I think, I'm sorry, I don't have to shop then? Okay. I also came from a large family, I think. If I need to, and then we'll all start talking at once. So health in all policy, I think, is really critical to establishing a community and an environment where the healthy choice is the easy choice. And I think we're slowly moving towards that, as you can see sort of the various organizations, agencies that are represented just here in working together to ensure that all aspects of health. I think we heard, I don't think I heard the term, but what we know is that health insurance and access and going to the doctor and medicine probably accounts for about 40% or less of health outcomes. Another large, and then there's about 10-20% that's genetic. And then there's another, I don't know if I'm getting my math right here, 40% or so that's really determined by something called the social determinants of health. What we're eating, how we're moving, how we're getting there, what stresses in our lives, education, all these other factors that per se we don't think of as health, but are really critical to our health outcomes. I think the fact that Monday it was, the master bike plan, you're seeing policies like these being weaved into policies of government, and I think that's really important, and that will move us as Howard County residents forward. Steve, if you had anyone else?
One of the things I just want to mention in reference to behavioral health is that we're doing a big kickoff in May for May is Mental Health Month, but we're using the tagline, is emotional wellness part of your fitness plan? Because, again, if you're managing your stress, if you're eating well, if you're sleeping well, if you're exercising, that helps your behavioral health too. So I just want to kind of throw that out there. It'll help keep down the numbers in Steve's emergency room.
So the NIH has linked noise exposure with obesity. What is the county doing to protect citizens from infants to elders from damage caused by noise in public and business venues such as movie theaters, entertainment venues, sports arenas, and especially in our schools, especially amplified electronic sound? Say that's the health department.
Yeah. So as some of you may know, the health department regulation has, we are enforcers of sound and noise coming from public venues. So to that extent, we monitor sound and noise from public places like Merriweather. We do not have jurisdiction over inside places like the mall, like schools. So to that extent, it was asked, what are we doing? We do enforcement for the public places. There was legislation about 2 years ago that actually raised the allowable decibel level from Merriweather. We enforce whatever the regulation is. If you don't think that's wise or sound, then you know who you can contact.
Very PC.
Your legislators, yeah.
Okay, this one says access to care subgroup. Are you considering integrating health equity into the health plan being implemented? I'm not sure that means the action plan. Integrating health equity.
So I would absolutely say yes. Health equity is extremely important and something that in a county as diverse as we are, that health equity is, again, a very critical issue and something that we will include in our action plan. We know that there are disparities and both in health outcomes as well as access, looking at the uninsured rates, et cetera. So health equity actually is not just for our work group. I would imagine it's for the entire local health improvement coalition.
So a couple questions on interpretation. Is there a cost? I think it means for an interpreter during an office visit. Do we have resources on that, maybe, Liddy? I don't know. Anybody? Actually, you could maybe talk about it from the hospital perspective as well.
Well, the hospital, in the inpatient setting, certainly, we do have resources that will translate to different languages. There's services that provide that service. I don't honestly know the answer in clinics, but I know there's a telephone service that you can use that many, Bill's here, Dwayne, do you use that in your clinics?
No, we generally, well, we have a bilingual staff, so at least for Hispanic speaking, we also have Chinese speaking providers, so it isn't to say we cover all linguistic needs of the patients, but the costs are covered in the sense that we are required by the state and by the statute to provide that service so as to prevent it from being an issue in access to care.
And it is a challenge in a community as diverse as we are. People come from really all across the world. And you know, we have service that provide that, but we can always improve.
Steve, Donna wanted that something.
At the Mental Health Authority, we do have a state grant that's called the Foreign-Born Outreach Grant. We fund a half-time position there of a Spanish-speaking person because that's the biggest population that we tend to serve with this grant. But with that grant, we contract with 11 different providers in the county who speak various languages. 2 are psychiatrists, the other are therapists. And we make referrals directly to them. They're usually people who can't qualify for the Medicaid program or the public system for reasons I won't mention, but I think we can all guess. And also, or the low-income uninsured and they're not eligible for affordable care or something like that. So we do use that grant, every dollar of it every year, and but we do try to cover folks in various languages. So if you have somebody who's uninsured or ineligible to get services in behavioral health, please contact us and we'll see what we can do to serve them in this grant.
And then for the door to healthcare, which is health department staff as well as Healthy Howard staff, we do have Korean, Spanish, and English. And then all other languages, we would do language line or language link, depending on the language. It's not ideal, but I think we have like 23 different languages that are spoken in Howard County. And clearly we can't hire 23 bilingual, bicultural staff. So our highest is Korean, again, Spanish, and obviously English. And so all others would be, we'd have to use language line.
I think somebody from Fern was here. Do we have somebody from Fern who wants to add anything to this? Yes, Fern. Paula, were you? No, she was. Okay. All right. Also on this one, can the PowerPoint slides be sent to all attendees? What we'll do is we will post them on the website and we will send out an email. If you didn't register and you didn't sign in, then make sure that you do on the way out. Give us your email address so we can get that to you. There's a question about oral health. Is oral health part of the Local Health Improvement Coalition? I think we have 2 work groups that have talked about that, so why don't you guys pick that one up?
So for access to care, oral health is a big issue, as you can see. We did have, I guess we have Howard County Dental Association represented on our work group. So and the other thing that we're working on is at the door to healthcare, when people are purchasing health insurance, we really want to encourage that they can also purchase dental insurance. Dental insurance, as most of you know, is not that expensive. It covers prevention mostly, and other sort of level 2, 3, and 4 is a little bit more expensive. But dental insurance is something that we really want to encourage and also make sure that people who don't have dental insurance still have access to dental care, which is really important.
On the Healthy Weight Work Group, we recruited someone from Howard Community College, where I also work. We have a dental hygiene program. They're going to work with us on trying to reduce sugar-sweetened beverages. So we're trying to work with them to kind of look at all angles of reducing sugar-sweetened beverages. So they're going to work with us on actually creating a fact sheet on reducing sugar-sweetened beverages and in the community where you can get hopefully low-cost or affordable dental care.
Okay, for a private physical therapy practice, how could we contribute to this initiative and who do we contact? Do any of the work groups want to address that? Or, I mean, I can tell you that you can contact us online on our Contact Us tab. Certainly, we're welcome, you'd be more than welcome, and it would really be up to you what work group you are most interested in participating with. Anybody have anything to add on that?
Just an easy entree to see if it's something that you want to pursue would be to come to a full meeting, which we said is in, the next meeting's May.
Yes, fourth Thursday of May. And actually, the way that works is we have from 8:30 to 9:30, we have the full LHIC meeting together. And then from 9:30 to 10:30, each of the work groups breaks off. So you could go and attend the work group you think you might be interested in. So we do encourage you to do that. Please let us know that you're interested. I should also mention that on our website is a place to sign up for our newsletters. We do what we call the bi-weekly LHIC Digest, where we, all of our partners can contribute information on their upcoming events, and we also do little snippets of news in each of the priority areas. So we would invite you to sign up for that as well, to stay in touch. Okay, so what are each of your groups doing to ensure that individuals with disabilities are represented and recognized? Start wherever you want.
Everybody's looking at me, so I guess I should take it. Obviously, individuals with psychiatric disabilities and/or substance abuse disorders are often stigmatized in the community, and it prevents people from seeking treatment. I think we try to address that every way we can. I know NAMI, is Beverly still here? NAMI's doing an anti-stigma campaign in the month of May, the local NAMI affiliate, so that's one thing that we hope is going to help promote decrease stigma, if you will. So, I mean, people are considered to have disabilities if they have a behavioral health. In the public system, of course, we're serving those folks who have a serious diagnosis and a serious impairment because of the diagnosis. But a lot of people have behavioral health disorders and get care from their primary care doc and go on with treatment and go on with their lives. So not everyone who has a behavioral health disability is disabled in the sense that we think of disability, but stigma is the biggest thing that keeps people from getting treatment, I think.
I would just add that I think all of us, in thinking about our work, thinks about especially the vulnerable populations that may be affected by healthy weight issues or access to care issues. So my bet is that we need to do a better job, but I think we are always thinking about those vulnerable populations, which includes individuals with disabilities, in how to engage them into whatever care or meet whatever their needs are. I think the challenge is for us is engaging in a format such as this or otherwise participation from those communities or special populations so they can tell us sort of what they may need rather than us deciding what they need.
Anybody else? Anything to add?
I guess the only thing I would add is that in the creating an age-friendly community, the number one priority was working with the most vulnerable people. And so as we work to implement the master plan, we will be focusing a lot of attention on that.
I might just comment on the larger population health perspective. One of the things that we obviously need to do is to do a risk assessment of our population, identify where the people are with the various vulnerabilities, and make sure that we're providing services that are near to their communities, that are easily accessible. So this is not a short-term initiative, but something we aspire to over the long run.
And there was another question. Someone wanted to know more about the CIT training, whether it includes listening skills. So I'm not exactly sure what that means, but I think there would also be some interest in knowing about if there is special training for people to deal with people with hearing loss as part of their crisis
Do the
intervention.
police have special training for that?
Yeah.
Is anyone here from the police department? Because I can't answer that question. I'm assuming, I know they do make an effort to reach out. We have a community service division of the police department, and we actually have a full-time mental health liaison person embedded in the police department with a combination of state and county funds for the last 2 years. And that's really helped. The patrol officers have someone in-house they can go to when they're dealing with a situation in the community around behavioral health. But in terms of hearing impaired, is that what the question is? Unfortunately, I can't speak to that. We don't cover that in our training, if that's the question.
I think
we do cover a lot of things. We just added actually a training on dealing with the older adult in the last couple of classes, because that came up from the police officers. We bring in people who talk about substance abuse treatment. We talk about traumatic brain injuries. We do bring a lot of consumers and family members in to really give their perspective to the officers. And we take them out to meet consumers in programs like On Our Own, which is our Wellness and Recovery Center, which we co-fund with the Health Department Substance Abuse Services. And we take them to some of our provider agencies for lunch so they get to meet consumers when they're not in crises, because the police are often dealing with them in crises. So it's a very packed week. It's a 40-hour week training. But there's nothing in there about the hearing impaired, but that would be something I think we should do. We can certainly bring that up at our next meeting, and I just don't know what the police is doing now.
Actually, they can call the non-emergency number, and they would give them that information.
So that's a good idea. Thank you.
You're welcome.
I think I went through all of them. Yeah, I think that's all I had. Has anybody else written down questions in the meantime? Any follow-up questions?
Yeah, I have been working for 3.5 years. We've developed a group called Howard County Sound Sense because we see that there's an increase in noise-induced hearing loss that's happening nationally. The American Public Health Association has legislation in the federal government level right now to reinstate the noise abatement arm of the EPA, but the chances of that getting through anytime soon are pretty limited based on how dysfunctional the federal government is. So we're very concerned that 1 in 5 high schoolers are among the 50 million Americans who suffer from tinnitus and hyperacusis, which is a very painful condition which may have a big impact on mental health and how they present in schools and in public settings. And that 1 in 5 teenagers suffers from the same degree of hearing loss as people 50 to 60. So there's 2 major sources of that. 50% of them are getting it from the earbuds and raising it too loud, but a lot of them are doing that to try to prevent their own exposure to outside environmental noise, and then 40% are getting them from clubs and movie theaters. We've been monitoring movie theaters on cell phones, and they're 116 decibels, which can ruin people's hearings in 20 minutes. So we're very concerned about this issue, but we don't know where in your, because it covers all these things. When hearing loss and hearing impairment is inflicted on people, it raises their carbohydrate cravings, it raises their cravings for painkillers and opioid drugs. So we don't know which, healthy weight, access to care, behavioral health, healthy aging, it really covers the spectrum of all of it. So, thank you.
Is there anything else you want to say from the health department perspective on that? Thank you for that information. I agree with you. When we went, when the Local Health Improvement Coalition formed and determined what the priority areas were, they really looked at the data and picked these 3 and now 4 priority areas. I'd have to say I also don't know where that would fit in, but I would encourage you to become involved because that's how the groups kind of decide what projects they're interested in working on.
Well, when I heard tonight that the suicide rate is staying steady, that's something that's impacted by this noise impact on violent behavior.
Sure, so perhaps behavioral health would be the right place for you.
And opioid use is skyrocketing. You know, this is something we really need to look carefully at in schools and inside theaters, which we understand the health department does not cover now.
Yeah. Did anybody else have questions written down? It works a little bit better if we have a question. Can you write down?
I don't have a question,
okay.
but I wanted to put a plug in for my organization. I work at Accessible Resources for Independence. We work with individuals who have disabilities to help them maximize their independence. All 5 of our core services are provided for free, so we can help individuals who have disabilities with consumer-driven case management, information and referral. We do independent living skills training like cooking, learning how to ride transportation, learning about their benefits, understanding how their benefits are affected by working and filling out applications. We also provide information and referral for community members, partnerships, organizations. So if you have a disability-related question, feel free to reach out to us. You can get a card or a brochure from me after the event. We can help you for free, and feel free to refer any consumers that you have that have a disability to us, and we can work with them one-on-one if they're interested.
Thank you. And you guys are part of the coalition, correct?
I don't think so.
Okay, well, I would encourage you to join, and then you'll have, then your website will be linked from our website, and people can come to the LHIC website and get to you.
And
Great.
yes, our main office is in Glen Burnie. 2 days a week, 2 days a month, I'm at the MAP Office on Aging, and then every other Wednesday, I'm at the Multi-Service Center in North Laurel.
What's the name of your agency again?
Accessible Resources for Independence, and we do all disabilities, any age, no proof of disability, and free of charge.
Were there anybody else have a question written down? Do you have one? What's the best way for faith-based organizations to partner with LHIC?
Just join.
There you go. Yes, so all our information is here. Contact myself or Alvaro, and we can get you, at the next meeting and tell us what you're most interested in, and we'll put you on the right work group. Okay? Great. Well, I think that's it. Thanks, everybody, and really thank you to our panel and our presenters.
Yeah, just in closing, I just want to thank everyone for coming. Take home brochures. If there's extra food, take it home to your family. It's healthy food. And please go to the website, join our local health improvement coalition, and participate in our work groups. And have a good evening and get home safely.
Thank you.